Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today's topic, we're going to talk about high cholesterol. And we're going to cover what is high cholesterol and the normal standard level of cholesterol level, right? And what causes high cholesterol and the risk factors for high cholesterol and the complication of high cholesterol. And in the end, we're going to talk about acupressure point for high cholesterol, right? So let's start. Now, if you were just signed in to watch this live video, now I actually have a great what I said, a great thing to share with you. I actually just received a very nice feedback, right, from Lover Ridge. I think she's probably from Auckland, right? And she said, "Hi, Szenan, this is Learned. My acupuncturist, Aaron Church, recommended your YouTube channel during this lockdown, right? So I have been having dizziness and imbalance for some time now. I've been doing what you have taught in this video every day twice. So this seems I have improved. It seems I have improved a lot since I have been doing this. Bless you all the very best. Learned. Well, you see, I actually make some difference with someone's life. So I'm quite happy for that. So if you have any feedback that you've been watching my live video, right? And what have you been using, or have you been applying all the acupressure point for you, for yourself? Or we talk about acupuncture as well. Have you been doing it for your patient or not? Now, no matter what, whether it's good feedback or bad feedback, like not working very well, I'm hoping that you can give me a feedback. So let me know whether there's anything that I can help you further, or let me know, just simply let me know what sort of what sort of things that you suffering from that is just dragging your energy down and you're in pain or anything at all. Just give me a comment and let me know that whether I can do the live video for you. But again, all this live video, you have to read our rule. I have a disclaimer. You have to read through it. It doesn't mean you have to stop go to your doctor. It's just something that you may be able to help yourself through acupressure point, right? So all this acupressure point, it can help you to get further. It can help you to relieve some pain, to feel more comfortable, but it doesn't mean that it will all fix you, right? So you need to keep in mind, right? So we have an online consultation. Now, if you want to take in, you want to consult with me and I can give you some herbs or anything at all, give us a call. Check down there. And there's an email address that you can send to our clinic and book an online consultation for your individual health issue. And we're happy to do that for you, right? So for a live video, we just topic, focus on one disease. Then I'll suggest you some acupressure point and give you some information that hopefully they can help you get through this lockdown time. And great news is I had 2 meetings with my colleague today, and we opened our clinic, so we're down to level 2 now. So on Thursday we reopen. So yeah, if you want to book in, if you're a patient of us or you live just around us, book in and we can see you. Or if it's too far away, yeah, we have an online consultation. We can take care of you as well. All right. Then let's talk about our first thing. Okay. The first thing we're going to talk about is, where was it? What is cholesterol? Right? All right. What is cholesterol? And you heard a lot. People have suffered from high cholesterol, right? Maybe you're one of them, or even if you're an acupuncturist, you may be one of them. And you try to treat yourself, not very successful. But here's an idea today. I'm gonna let you know. I'm gonna inform you. I'm gonna give you information about what is cholesterol and how you can do it easily and even without treatment. Do it easily. Just change some of your lifestyle and you're back to normal, right? Let's have a look. Cholesterol is a type of lipid. It's a waxy fat-like substance that your liver produces naturally, right? Where is cholesterol produced? From your liver, right? It's vital for the formation of cell membranes, certain hormones, and vitamin D, which mean our body use cholesterol to function, to keep us in health properly, right? So the cell membranes and certain hormone need cholesterol, right? Make sense? Okay, that is the thing that we need cholesterol. If we talk about cholesterol, oh, high cholesterol is so bad, and why do we get cholesterol for? No, when cholesterol used improperly and cholesterol is on the standard level, it's actually a good thing. It helps our body function properly, right? Let's see. Cholesterol doesn't dissolve in water, so it's an oil thing. It's a lipid, no? So it doesn't dissolve in water, right? So it can't travel through your blood on its own. Our blood is actually 60 to 70% made out of water. So it's basically water, So it can't transfer in our blood system. So therefore, to help transport cholesterol, your liver produce one thing called lipoprotein. So what's lipoprotein? Lipoprotein is partly made out of fat and partly made out of protein. So those things together are called lipoprotein. And the lipoprotein carry cholesterol go through your blood. That is how it actually transport on all around your body, right? In the blood system. Okay. So lipoprotein is they actually not just the lipoprotein not just carrying cholesterol. It carry another thing called triglycerides. It's another type of lipid, right? Through our blood system. The two major form of lipoprotein are low density lipoprotein and high density lipoprotein. Now we call it LDL or HDL. Okay, we heard a lot about it, but you probably didn't know about what is stand for LDL. So LDL is low density lipoprotein, and HDL is high density lipoprotein. All right, does it make sense for you? Okay, let's keep going. So to be honest, high cholesterol typically causes no symptoms. And people suffer from high cholesterol, they feel nothing. There is no particularly symptoms like heart disease, you get pain in the chest or stomach problem, that digestion problem, you get stomach bloating or pain in the stomach. No, high cholesterol, you don't feel it at all. Okay, not until it formed to the other problem, like not until it blocked out your artery and it become coronary heart disease and you start to get pain on your chest, right? So we know cholesterol, high cholesterol, it can cause other disease. So therefore, it's important we need to get it checked regularly. How often? Now, normally we get yearly checkup and you get it all checked out. If yearly is fine, then it's fine. But if 6 months, if you suffer from it, you have high cholesterol, and my suggestion is every 3 months. When you change your diet or lifestyle, check it in 3 months, and monitor whether, or even monthly or 2 months, once every 2 months, to monitor whether your cholesterol dropped down to normal or not. Right? This is something that I would suggest my patient to do. Right? So we have LDL cholesterol, we have HDL cholesterol, right? And which one is bad cholesterol? Right? The LDL cholesterol is bad cholesterol, right? So low density lipoprotein is often called bad cholesterol. It carries cholesterol to your arteries. So if your levels of LDL cholesterol are too high, it can build up on the walls of your arteries. When it build up, it build up on your artery, on the side of your artery. We call that it build up a plaque, and the plaque build up bigger and bigger, and it actually block your artery. So the blood flow can't go any further. If it happened in your brain, in your artery, that you got stroke. When it happened in your heart, then you got heart attack. Those are the two major things. When it comes to cholesterol, the risk for cholesterol. Okay, so HDL cholesterol, or we call it good cholesterol, right? So it helps return. So HDL, the good cholesterol, it actually helps return LDL cholesterol to your liver to be removed from your body. So it's help prevent cholesterol plaque from building up in your arteries. So now we know that the HDL is actually helping the LDL to get back to liver and to remove from your body, and to actually decrease the plaque, which the plaque has been built up in your arteries that form LDL, right? So HDL is a good HDL cholesterol has been functioning very good for our body. And to be honest, they both work together. If there is no LDL, there's no point to have HDL, right? So in Chinese medicine, we call one is yin, one is yang. Husband and wife, they both work together, right? Simple. Now we're gonna talk about there's another called triglyceride. Triglycerides. I'm not very good in pronounce in this one. Triglycerides. It's a different type of lipid, right? So they are different from cholesterol. So this one is very different with cholesterol. So while your body uses cholesterol to build cells in certain hormones, it uses triglycerides as a source of energy. So, which means our body using the cholesterol, right, to build cells in some hormones, but it needs energy to provide this function, right? And where did it get the energy from? It actually get it from triglycerides as a source of energy, right? It actually uses as a energy. Okay, so where it actually come from? When you eat more calories than your body can use right away, it converts those calories into triglycerides. it stores triglycerides in your fat cells. So it also uses lipoprotein to circulate triglycerides through your blood stream that we talked about that already. So if you regularly eat more calories than your body can use, so your triglycerides level can get high and high and high, right? So this may raise your risk of several health problems, again, including same as LDL, cholesterol when it's high, it can cause heart disease and stroke. So it's the same, right? So now, to be honest, again, to monitor those things, you need to get, like for me, I actually get body checked up yearly. You know, it's simple. Just give some blood and they can run the blood test. And we're gonna talk about the level. You know, what is the level? To be honest, the level is very different. I live in New Zealand. And apparently our reading is so different with American one, and I don't know other country, right? So in New Zealand we use MMO/L, so MMOL/L, but in America they use MG/DL, so it's very different reading. Let's talk about in New Zealand where we are. So if you're my patient, this is the standard of New Zealand. So we know LDL cholesterol is bad one, so we want to keep it less than 2.0 mmol/L, you know, 2.0. But if you're in America, your LDL need to be less than 130 mg/dl. 130, 2. We are using 2. They're using 130. So it's quite different. It's totally quite different. Now, let's talk about what about HDL cholesterol. HDL cholesterol is a good cholesterol, right? We talk about that. So it needs to be greater than 1 mmol/L. And in America, it need the readings different. It need to at least higher than 55 mg/dl. Or for female, somehow for female, this is for female, and for male it's actually 45. It needs to be at least higher than 45 for males. So that is the difference. It's very quite different, right? We're using different reading. And then, so what about the triglycerides? We need to go less than 1.7, 1.7, okay? And for the American reading, it has to be below 150, right? 150. So you see, the bad one need to below less than. LDL in American reading is 130, and on the bad one, the other is triglycerides is actually less than 150, right? But for New Zealand one is 1.7, and the other one is actually 2, right? So it's quite different. And in the good one, HDL, we need to greater than 1 in New Zealand, and in America is to be 55 or for female and 45 for male, right? And the total one is different. The total one, in America they call, and the total blood cholesterol is to 20% of your total triglycerides. And a New Zealand reading, we said the total cholesterol need to less than 4, okay? And which means the total cholesterol divided by HDL ratio, it need to less than 4. So it's quite a different reading between New Zealand cholesterol New Zealand cholesterol reading standard and American one. Okay, I don't know about your country use. You can simply just Google it and you'll find the reading, the standard reading that you need to. Okay, now let's move to the risk factor for high cholesterol. Right now, you may be at high risk of developing high cholesterol if you are overweight. If you're overweight, yes, that may be a risk for you. Okay, so how do you know that? I'm not saying every overweight person have high cholesterol, right? How do you know? You don't know, so don't judge it. Look at people overweight and say, oh, you have high cholesterol, but yes, they are in a higher risk for it, and which means they have to go and get tested. But I've seen a lot of overweight people. They don't actually get high cholesterol, which mean their body and their liver are functioning properly, still going pretty well. Okay, not until the LDL is working a lot, producing quite a lot, but the HDL is lowered down, and they couldn't bring the LDL back to the liver to process and remove it out to the body. Then that may be a problem. Okay. Some people don't exercise or eat unhealthy diet. So what is unhealthy diet? What is unhealthy diet? We're going to talk about that later. So apart from eating and don't exercise regularly, yeah, exercise can actually reduce the high cholesterol. But I'll tell you what is the best way for lowering your cholesterol. Okay, smoking. Smoking is bad. Okay, and some people have diabetes and kidney disease or hypothyroidism, and those are on higher risk for to suffer from high cholesterol. Okay, let's talk about the symptom. To be honest, you don't get symptom. As I mentioned before, you don't get any symptom for high cholesterol, not until it forms to other problem. So what problem can it let go? Can it be? Okay, again, it actually go for we talk about that in the overview. What is cholesterol, right? On your blood, if the low LDL cholesterol, it can stay there and build up what? Build up plaque. Build up plaque in your bloodstream, in your artery. Then what happens is when it build up and build up, and then if the artery in your heart it's been building up cholesterol plaque, and the less and less blood going through, then we talk about coronary artery disease in the few I think few live video before this one. Yeah, we talk about that. So if that happened in your heart, you get heart disease, you get angina, you get heart attack, it can build up your high blood pressure as well. So let's see, we talk about high blood pressure. High blood pressure is a symptoms. Where did it come from? It can come from high cholesterol, right? So, and if it happened in your brain, in your arterial brain, that build up the plaque, and that can cause stroke, right? Of course, it can cause the chronic kidney disease as well. So those things, you can change it by changing your diet. All right. Okay, that we talk about all this already. Then I'm going to give you some solution. So this solution may help you reduce your high cholesterol. And I've seen it. So I suggest you guys go to YouTube and watch over 100 years ago. The last review I saw, the doctor, let me check his name, Dr. Ellsworth Graham. He was a cardiothoracic surgeon. So the last review that I saw on I watched on YouTube It's actually he is 104 years old. 104 years old. He got a review. Another review I watched on YouTube, it actually 98 years old. And on that review, okay, he mentioned that he when he was 98 years old, he received that review on YouTube uh, video, and he actually mentioned that he was a vegan. He probably still is a vegan. I don't know whether he's still alive or not. Okay, to be honest, he is he was vegan for his half life, which means is uh, around 50 years old. 50 years, like 49 years, half life, 49 years for vegan. And he was still healthy and mow the lawn and do a lot of stuff, you know. Then he talked about one real thing, you know, to to lower your cholesterol. Okay? People will do exercise, but he said, well, the great one is change your diet, because we know when we eat, if you take uh, what they call saturated fat, and they will bring your cholesterol high, bring up your cholesterol. Then one thing is, if you go for exercise, yes, it can come down, but not as well as managing your diet, right? And he suggests vegan diet. He suggests vegan diet. If you have a chance to go and read the China study, and Dr. T. Campbell, he said, not just the fat that can cause high cholesterol, and actually the animal protein can cause high cholesterol. So the best diet for high cholesterol is vegan diet, which is plant-based diet, no animal proteins at all. And of course, watch out the sugar and the saturated fat, and those are very important ones. Okay, yeah. So the best thing is in your diet, and I'm gonna show you some acupressure point. To be honest, without the acupressure point, if you're changing your diet, you're gonna be okay. You know, you can change it. And how do you monitor? Change your diet completely, but of course you need to have the knowledge. Where do you get the knowledge? The first book that I want to introduce you is not by just listen to me. That's not good enough. You haven't got enough information. The best thing for you is the China study, the book of the China study by Dr. Campbell. All right, very good book. Yeah, you should read it and get an idea for yourself and change your diet. If you suffer from diabetes, high blood pressure, high cholesterol, and heart disease, or whatever it is, then if you change the diet, we'll see, oh, the blood pressure become normal, you lose weight, and you whatever, your cholesterol drop down, and your blood sugar reading become normal. It's possible. It really is possible. Okay, whether you want to do it or not. So, Dr. Wayham, he said about, well, people talk about exercise. Everyone can accept it. We can just normally talk about exercise, and we don't have any opinion for that. But when it comes to diet, and people were very offensive, say, no, I don't think you're right. Blah, blah, blah. You know, be an open mind. If you want to help yourself, if you want to help your patient, if you want to help your family, if your family member, your mom and dad or grandpa, whoever suffer from cholesterol, and you don't want to be one of them, you need to watch your diet. It's been proved that in helping. We have patients, I have friends just changing the diet for 2 months, one for 2 months, the other for just 1 month, and the cholesterol become normal. I didn't give them treatment, just advising diet. You know, it's so simple. It's so simple. But again, you need the information. I recommend you read the China study. Okay, so why do I still suggest you acupressure point? Because all this acupressure point will help your organs function better, especially your liver, because your liver need to detox. Your cholesterol, your LDL go back to your liver and need to detox. So you need to have a good liver function. So the acupressure point will help your liver function better. It can help your blood circulation better because you need the heart pump better and the circulation better to bring all the LDL back to your liver to function. Okay, so if you suffer from high cholesterol and you're tired and you have heart disease, whatever you have, or the disease and stroke or whatever, and you need those points to help it as an additional on top of changing diet. But I won't suggest you just do the acupressure point without changing your diet. That is not a way to get your cholesterol lower. So I quite pissed off for the medical doctor, to be honest. There are a lot of medical doctors doing a great thing, but some of them are not doing properly. Even some acupuncturists and some Chinese doctor. Why is that? Because they believe in if they have high cholesterol, they have to take Chinese herbs or do acupuncture, but not changing the diet. And I have a lot of patients come in, they say, high cholesterol, what? Are you on high cholesterol pill? Yes, for 20 years. I say, what? Why don't you, it's quite clear, it's from your diet. Why didn't your doctor suggest you about a diet, changing a diet? Instead, they just convenient, just give you a pill, go and take it, and the cholesterol level back to normal. What about you? And you stop it came back again. So you're not actually treating it, you're just controlling it. And my opinion is, if you want to treat it properly, do it properly. That's my opinion. And I'm here really want to help you. And I want you to get better, not through medication. Medication can manage it, can control it, but it can't actually get rid of it. Diet is important. So let's talk about what point. Acupressure point, simple one. So your thumb, here is your open up like this and this line and match this line and over here. So this is level 4. So massage like this. This is number 1. Number 2 point, go over here. 3 finger down here. This is what we call pericardium 6. Yeah. So press over here. You find a sensitive point over here between the tendons or outside of the tendon or the other side of the tendon. Get the ulcer point. We show it a lot in other videos as well. So get a sensitive point on those points and try to work on for 10 seconds, 30 seconds, or even 1 minute. Okay, do it once a day, and this one once a day as well. So it can bring up your organs function, and when your organs function better, you feel that with your changing of your diet, become plant-based diet, and your cholesterol will drop down very quick. And the other one is here. 3 finger below your knee, and the kneecap underneath you have a big tendons. So on both sides of the tendons, you will find 2 hollows. Yeah, excuse me, bless me. So on the 2 hollow, on the outside of the hollow, which is on your little toe side, so 4 finger below that. So in the middle you have a bone. So 1 finger distant like this distant from the bone, and 4 finger below the external hole of the knee. Then on there is stomach 36. So find the sensitive point and massage over there. Then what happened? It can massage those 2 points every day, each point for about 1 minute. Where it can help your organ function better and better and better. All right, this is the thing that you should do every day. And abdominal breathing, practice abdominal breathing. You can go online and search what is abdominal breathing that you should do, and exercise, 2 legs exercise. And my 2 leg exercise is simple. You can search on YouTube that I have some exercise in there that you can do to do, and do those things every day. 3 things, 3 acupressure point, 1 abdominal breathing, the 2 legs exercise, okay, every day, or 平甩功 every day. So, and as well as changing your diet. We know exercise is good, it can lower your cholesterol, but do it properly, changing your diet, become plant-based, use plant-based diet, become a vegan is the best, I know a lot of people think about go for exercise. Yes, you can for when you're getting older. Like if you ask a 90 years old, 100 years old, 80 years old person, if they have suffered from high cholesterol, would you ask them to do exercise? You need to do more exercise to lower your cholesterol. That's because you lack of exercise. No, that's wrong. That's because they're on a wrong diet, right? That's it for today. So we're gonna open our clinic. So I won't be able to do this live video at night time. If we open our clinic, it'll be busy. So I would do a live video in the morning, early in the morning, probably 6:30 or 7 o'clock every morning. Okay. Again, we're gonna talk about a lot of topic. So for patients, so I hope in the morning it still suits you and still good for you. If that is not a great time for you, that's okay. It'll be on our Facebook, so it'll be on our YouTube. So check down there to get our to join our Facebook page, so you won't miss out my live video. So as well as subscribe to our YouTube channel, and as well as I have an Instagram account down there. On Facebook is up there, I think, and YouTube is down there. So check it all on and subscribe it and follow me so you won't miss out on those 3 platforms. I'll do it in the morning, but it's okay if you can't watch it in the morning. You can rewatch it. You can watch it afterward. Okay. Stay awesome, and I love you all. I'll see you tomorrow. We're gonna do it in the morning, 7 o'clock or 6:30, depending on my schedule. All right. See you. Stay awesome. Bye bye.